welcome back again to our Community Health Education Series, a collaborative initiative among Mass General Hospital, the Community Health Improvement Team, and the Chelsea Cable TV here. Today, we have a wonderful panel, starting with Gabriel Fonseca, who is the Associate Director of Resident Services at the Neighborhood Developer, Inc. Of course, we have our lovely Bob Repucci from the Executive Director of the CAPIC in our community. And then we have, as usual, Pep Vicente, the Community Outreach Worker from Mass General. In today's topic, we're going to be address a very important thing, how to be living in a healthy condition.
Hello, Dr. Chen. So you mentioned in the social determinants of health in your introduction. Can you explain it a bit more and how social determinants of health can affect people's health?
Yes, thanks. That's a wonderful question, and we have discussed this a little bit the last time, but I think it's very important to repeat what is the meaning. So social determinants of health or social illnesses is a term that we use to define the place or the environment that we are born, live, work, learn, worship, and age. So because these conditions are the conditions that we face daily, it affects greatly to our health and in turn to our quality of life. So most of these conditions, for example, if we face difficulties on those conditions such as we cannot afford nutritious food, we don't have a stable housing, or we can't find like good access to medical care, it will cause a enormous impact to our health. But also in America, we lead in medical research and we invest the largest amount of money for medical care. And for the amount of money that we're spending, we should be in the top, we should have the healthiest people on earth. However, most of the indicator, the important indicator, such as how long people can live, is not even in the top 25. We're even behind Bermudas and Anguilla. So it's really, this gives us an opportunity to think about health. And actually for people, for individuals, they have the opportunity actually to start managing their health long before they start seeing a doctor. Because these determinants of health actually is things that we face daily. That means that actually we should be able to learn more about it, and we should actually advocate and also work with our government to improve these different determinants of health.
So now let me ask you, what is housing insecurity and how big of a problem it is in this county?
Housing insecurity is actually one of the most common social determinants of health that we suffer. Per the Department of Human and Health Services, housing insecurity is defined to the high cost of housing in proportion to the income. It includes also poor housing quality, overcrowding, unstable neighborhood, and to the extreme of homelessness. Even though in Massachusetts we don't see a lot of homeless people around, however, there's a lot. This problem is severe. Almost half of the renters and 30% of the homeowners are burdened with the high cost of housing. And also, the people that are most affected are those that are more susceptible, such as children, where their development depends a lot in the environment that they live in, and also with people with multiple chronic medical conditions, such as mental health issues, substance use disorders, and also diabetes and other metabolic syndrome things. The evidence also has been shown in multiple studies by scientists, and the direct effects include many. For example, when there's overcrowding, there's more exposure to infectious diseases. Also, the low quality housing that usually is the only type of housing that poor income family can afford has more environmental hazards, such as lead in the paint. Some of the lead can be also in the tubes, the water, things like that. Also, things such as dust mite, allergens that trigger asthma symptoms, and also rodents that can increase a lot for that make children to suffer from asthma symptoms. So not only that, we have it has been seen also by Mass Health that the members that they have that has housing issues or homelessness actually housing insecurity drive up a lot the cost for healthcare. These people are much harder to manage and control their disease, such as hypertension, diabetes, heart diseases, heart failure, and it has shown that people with housing issues have increased, and compared with people that do not have this issue, is 4 times the healthcare cost for them. So the purpose of this show today is that we hope that the community get aware about these social determinants of health, and also learn about the resources that we have in our community and how to manage these resources when they're facing with some of these challenges.
Thank you, Dr. Chen, for your explanation of the social determinants of health. That makes great sense. Now let's continue and hear from our guest. Welcome, Bob.
Thank you.
To the show. What is the current situation of housing insecurity in Chelsea?
Well, Pep, we find that housing insecurity in Chelsea, for that matter, Revere and Winthrop also, we're in a crisis. So we view housing insecurity as an at-risk problem. So what we try to do is identify the persons that are at risk for displacement. We do that by looking at 2 determinants. One is the U.S. Department of Housing and Urban Development, HUD. They define persons that are at risk for homelessness as anybody that earns 30% of the median income in a community. So the median income in Chelsea is about $50,000 annually. And we have about 2,000 households in the city of Chelsea that earn below $20,000 annually. So at 30% at the median income is $16,000. So you can see very easily that if we have 3,000 households that are at risk, these are households that are at risk of homelessness. The other determinant that we use, we look at how many persons spend in excess of 50% of their income on housing. CAPIC, which I direct, did a survey back last year. We distributed 2,000 surveys. We received 785 responses. 47% of the persons that responded, and this survey was conducted among our own service population, and we service about 15,000 people annually. And we found that 47% of those persons that responded spend in excess of 50% of their income on rent a year. So here we have the HUD at-risk definition, 2,000 households. We have, in addition to that, another 2,900 households from CAPIC, CAPIC's database, that are at risk of homelessness. So by identifying persons that are at risk for homelessness before they become displaced, that's the key, and that's the prevention work. We have the tools to be able to do that, to be able to identify these households and intervene before there's a problem. There was a program in the state back between 2002 and 2009, funded by the Commonwealth of Massachusetts, that was called a homelessness prevention program. And that program, when that was in operation, hotels and motels were never used in Massachusetts. When that program ended in 2009, 1 month after that program ended, the Commonwealth began to use hotels and motels again to house people on an emergency basis. So really, the best work that we can do for the persons in Chelsea is to identify who's at risk for housing. And it's important that people that are having difficulty paying their rent, paying their utilities, that they do something about it at a very early stage.
Mm. So what population group is at a higher risk for housing insecurity?
Well, everybody is at risk, first of all, that has an inability to pay naturally. But the segments of the population that we find today are at greatest risk are those persons that have substance use disorders. This is the population of people that, because they have a substance use disorder, they're unable to pay rent. Oftentimes they're homeless. It's this segment of the population that we're working with today. We find that 60% of all the persons that we see that have substance use problems are homeless. The other segment of the population that we're dealing with is our elderly persons, and in particular veterans. These are people that have fixed incomes. We don't have, and I wanted to mention also that that the median rent in Chelsea, according to the 2010 census, was $1,250 a month. So of course here we are in 2017, and we probably are closer to $1,500 a month. So persons that are on fixed incomes, and in particular veterans that may be receiving disability, are probably earning just about that, are receiving just about that benefit a month. So it's almost impossible for them today to find a place to live that's less than $1,200. So we're finding that we're relying on single resident occupancies to be able to house persons that are single, that are on fixed income, and we're in the process of developing more of those.
A question for you now, Gabe. Welcome. What housing resources does Chelsea have?
Well, in Chelsea, we have resources. One specifically is Metro Housing Boston. That's an entity that lives in our building at the Neighborhood Developers at Ford Garish. At that agency, there are housing specialists that one could meet with to help understand what resources are available. So I'd like to highlight that as one of the key resources in our community. Furthermore, we heard from CAPIC here. There's an abundance of resources at CAPIC, but what I'd like to note is as I'm listing these resources, each one of these programs have criteria that's figured out on a case-by-case basis to see if you're eligible for certain programs. Also, we have Chelsea Housing Authority. Furthermore, Chelsea Collaborative can also help out, but I'd also like to tell the audience that there's one resource called ourchelseama.org that has a list of resources that's broken down by categories, and housing and food insecurity and mental or medical health issues can be helped. You can learn what resources are available there. Excuse me. But also, I'd like to highlight what I do at the Neighborhood Developers. Over the last year and a half, we've built a program that's focused on supporting those that are at most risk of being evicted. The Neighborhood Developers is focused on creating communities of opportunity. So in our buildings, those that live in the Neighborhood Developers, we're able to monitor their rent payments. We're able to help identify those who have either a trend of making late payments or those who are really behind. And the scope of our work in resident services is to offer support to those people early so that they can access the services that are available in the community. But of course, that's at the Neighborhood Developers, and we own a number of properties, and we have over 900 residents. But those are just a few of the resources. So thank you, Pep.
So what are the eligibilities or criteria required for people to seek help in housing?
Well, like I said, first you need to reach out for help. It's important to realize that although some information in the community might not be the truth, you might be hearing from others that there are programs that they qualified for or that someone else qualified for. First, make an appointment or walk in and seek the help from a specialist or an agency. They'll walk you through the eligibility criteria. Yet, like I said, the first thing that you need to do is realize that there's help out there. And when there's helpers like us here at the table that understand that when you're struggling to pay rent, it impacts your health. And it also impacts your family. But furthermore, when our neighbors are struggling, we're struggling as a community. So to highlight what I'm saying here is seek help, but also realize that it's a case-by-case basis.
An often asked question now, how to avoid losing your home?
Well, again, on a case-by-case basis, it's all different. Many people who are on the face of losing their home is due to non-payment or due to, so let's say, lease violations. When you are served with those, what I think is the best, what we know is best, is for you to be open and honest with the property manager or your landlord. I would just say that accessing resources is an easy thing to do if you're able to ask for help.
So what measures are in place to help people access and use housing resources available to them?
The measures that are in place, for example, like I said, with Metro Housing Boston, they have walk-in appointments, but also our phone numbers listed on the slide here at the Neighborhood Developers. There are housing specialists that you could meet individually, yet there are also workshops that are offered, workshops that are focused on helping people understand the ins and outs of affordable housing and how to really access and maintain your affordable housing voucher or your affordable housing apartment.
Now a question for you, Bob. What to do or where to go when someone is in a housing emergency situation?
First, I just want to emphasize that it's very important. It's one thing to be at risk for homelessness, and it's something else to actually be displaced from housing. So it's much more difficult to find housing for somebody today because there are limited incomes and rents are so high. And quite frankly, there are not enough resources out there that can cater to all the situations that people have. So it's very critical that, that people, when they're at risk, that they do something about it at an early stage. However, when they do have an emergency, there are different types of emergencies. If it should be the result of displacement as a result of a fire, certainly the Red Cross is the first line of defense along with the City of Chelsea and emergency services here. CAPIC is a partner with the City of Chelsea in being able to provide assistance to persons that have emergencies in housing. But there is no silver bullet. There are not huge, vast resources available to pay rents these days. So we have to be we have to work very hard to try to mediate with landlords to be able to create situations that will allow people to remain in housing. But in the case of natural disaster, there are plans that the city has that is helpful. Recently, the City of Chelsea, in partnership with the Christian Church here in Chelsea, opened up a warming center. It's a resource center, and that's run by Pastor Valier. That resource center is available on very, very cold nights. So there are persons without housing that may be displaced as a result of no heat in their house that night. They can go to this warming station for one night or 2 nights.
Thank you very much, all of you. What is the final word that each one of you would like to share with our viewers about today's discussions of housing insecurities?
Thank you. Yeah, I really am really thankful that there's a lot of resources and agencies that are interested in this problem. I want the audience to understand that this really has huge impact on health, not only to develop health, but also to prevent any illnesses, and prevention is much better. Get help, as Gabe have mentioned. We need to get help before the situation is worse, and this can be many agencies of the community. And remember also, you can talk to your doctor. In most of the hospitals already, we have started to ask information, what we call the screening, about these different social determinants of health. That's why it's really important that you start addressing these issues also with your doctor, if that is the first place that you could get access to. Not only that, probably the housing cost is going to be a little bit out of our hands, and our patients might feel powerless. However, the condition of living is in our hands, helping to figure out how to decrease overcrowding, to decrease exposure to infectious diseases, how to address with the landlords and the different housing authority to improve the condition of housing, to make it up to code, to make sure that the paint is up to code, to make sure that the hygiene is good, the environmental hazards such as particle, what we call the trigger, the fume, the different things that can activate asthma in your child, to address that even not needing to move out of the house. So discuss with your doctor, seek for help, and do your best to improve your living environment. And also remember, we are a whole community. You say, when we are in trouble, our community in trouble, that means that everybody has the responsibility to help.
Exactly. Yeah, that's a perfect point that I wanted to make, is that working together to support our neighbors is one of the solutions here. When our neighbors are struggling, we're struggling. Yet furthermore, there's hope and opportunity. I'd like for you in the audience to realize that we are just part of the movement that are fighting for healthy homes, that are building opportunities for people in all our communities. So I'd like for you to know that if you are interested, you could call me, and you could learn about the opportunities that are existing in Chelsea, such as the coalition work. But housing insecurity can be addressed. It should be addressed, and it can only be addressed uniformly and together. But my final point is, when you ask for help, that's a big step. And I know that. And once you ask for help, you hopefully will get it from people like us.
I just want to say that I believe that housing is the most important responsibility that families have and individuals have. It should be the first concern that you have. It should be the place where your income goes first, having a roof over your head. It's critical that people that are in potential housing displacement situations do something about it early. So don't let yourself fall beyond 1 month in rent without communicating that to your landlord or coming to one of these great organizations for help. We may not be able to come up with the resources for you that you need, but we will be able to do something for you. We'll never say no. We'll step in, we'll intervene on your behalf, we'll find resources if we don't have them. But it's very important that you don't wait until the end. You don't wait until you're 2 or 3 months behind in your rent or having disputes with the landlord. You need to settle those matters very early on in.
Can I add one thing? Just in case there's people that feel that they don't have this issue, do remember that we're all neighbors. If you can improve the housing situation of your neighborhood, you're improving also your own health. So go out, advocate for more affordable housing that are like good quality. Go out and advocate for improving the housing situation that is in our community.
Yes, I'd like to add, if there's an elderly person in your community, just shoveling their driveway or offering a hand to help helps not only them, but it's going to help you. When we help each other, it feels good, doesn't it? So thanks for this opportunity to talk,
Yeah,
Pat,
thank you.
and
Thank you.
Dr. and Bob.
So thank you everyone for your attention, and I really appreciate all the information. And remember that you feel that you are burdened by the housing cost, please reach out to any of the agencies, CAPIC, the neighborhood developer, the Chelsea Collaborative. We might not have the solution, but we can work together in these different solutions. Remember also that housing affects a lot in your health. So if you have any medical illness that you feel is out of control, also look at and seek help for housing issue. We really, really are asking you to help us together to build a better neighborhood for Chelsea. Thank you everyone and have a good day.